This is our mission statement.
To show and share the love of God,
as seen in the good news of Jesus Christ,
by providing integrated,
affordable,
and quality health care
to those who need it most.
Some years ago, a family doctor came to me and said, "What do your people in Southwest Detroit do for health care?" I told her some of us have care, some of us don't. And she said, I will treat anybody that you send to me. That began this process, which has evolved into Covenant Community Care.
Covenant Community Care serves people who need it the most. We provide medical care, dental and mental health services. Currently, we have more than 5,000 people under the care of our full-time physicians. Our doctors have dedicated themselves to caring for the poor in Detroit. We have an open door to everyone. We serve the uninsured, Medicaid, Medicare. Everybody is welcome here. Several years ago, Covenant Ministries of Benevolence took an interest in our vision of hope for Detroit and offered to help.
I'm very happy to be part of a larger church, the Evangelical Covenant Church, that has made a strong commitment through its Department of Compassion, Mercy, and Justice to help us to get this mission going in Detroit.
Our staff is built around full-time physicians and full-time nurses. Dr. Lydia Best is our medical director. She provides excellence in service for us. She supervises all the work of our medical team, and she brings all of her expertise to bear on providing quality service to all of our patients.
I remember when a lot of the teachers were laid off. We had a lot of patients that were teachers. We have a lot of patients that are self-employed. And then we have patients that are in transition from one job to another or haven't been able to find work, or a lot of patients that have lost their insurance. They've had a doctor for 20 years and now suddenly they cannot see that person anymore, and they're discouraged when they come. But they find that here's a place that they can feel welcome. And
mostly right now, you don't have insurance, you don't have a place to go to where everybody try to go to some places that are full and they don't give it to you attention. So that's fantastic for me, most in this situation, and for the tough time the country passed. Here is fantastic help for everybody.
When you don't have insurance and you don't have a good enough job to pay somewhere else for a visit. So this place helps a whole lot, that you can come and be taken care of and prayed for.
What people need is they need to be loved. They need to be loved back to health. Together with medical, dental, and mental health services, our staff communicates that the person is important, they're important to us, and that the love that we share with them is part of what makes them whole.
It's absolutely necessary not to pass judgment on how people got where they are. We just have to meet their needs where they are. That's what love's about.
We welcome anyone who wants to be part of the good work that God is doing here in our neighborhood. You need to be able to get in step with people who love the poor and serve the poor. You need to be able to put the other person first and yourself second. And if you can do that, you can be part of this good work here.
My name is Lynn Eicholt, and I'm a dentist for Covenant Community Care. We wanted to open our clinic to provide care for them, break down the barriers to access for people, provide affordable dental care, quality dental care, and give people, a smile that they can be proud of. Oral health can affect the whole body. Gum disease can lead to heart disease. It can lead to diabetes, so we're treating the whole patient, not just their mouth.
At our clinic at Waterman, we've been invited by Southwest Counseling Solutions, which is a community mental health center, to open up a clinic there. We now have 7 exam rooms there. We're able to serve more than 2,000 people there. And our doctors work hand in hand with their mental health professionals, with their psychiatrists, with their therapists, to make sure that people who need it the most with mental illness are getting the health care they need.
People with severe and persistent mental illness die 25 years earlier than the general population. That compelled us to try to do something about it. We approached other entities in the community, and they really were not interested. So when one of our clients told us that there's this small faith-based primary care that we are going to, we followed our clients, and it's been a natural relationship ever since.
What I've experienced is that the people are caring. You can feel God radiating through them. This is the type of care and nurturing environment that I've experienced. When you walk in the door, you see a cross, you see a prayer box, and you meet people that are concerned about you. This isn't just a 9-to-5 job. This is also a ministry. You're getting healed physically, mentally, and spiritually. It's like a glove on a cold day. It's like a snuggie.
It could be overwhelming if we think, I have all of these patients with all of these needs, but knowing that they're not our patients and that the needs are in His hands, that they're in His hands, and that we're in His hands, just centers us and reminds us that we're not in it alone.
We are in the shadow of the decrepit train station here in Southwest Detroit. But at Covenant Community Care, you have the new life that is springing up out of the ground. And that's coming from God who loves us. God loves Detroit. God loves every Detroiter. And we get to be a part of that love every day.
To have a clear understanding of who Jesus is and His compassion for multitudes is to be motivated to restate that gospel in acts of kindness, in meeting real people's needs, and being a sanctuary. Sanctuary is a double entendre. It's a place where God is worshiped. It's also a shelter. It's a safe place for beat-up people. And a lot of people know that the community in Detroit has taken quite a beating over the last several years. But we believe this is a great community, and we're glad to be here.